So what I'm really excited about this year is our intensity and our focus on in-office procedures. And why? Well, the answer is number one, and most importantly, great outcomes. We now know that we can target specific anatomy and very specific structures within the nose and sinuses and the whole ENT field, that if we can do targeted therapy that's very, very straightforward, we can give maximum relief with very, very little downtime. Number two, healthcare burden, healthcare cost. The more we can do in our own small setting, the more we can do efficiently, that lowers the cost of healthcare to the patient and also to the healthcare system, which is a very important thing right now. And number three, the opportunity to provide more care to more people. A lot of times, if we do very specific types of techniques in the hospital or an operating room, we are relegated to that hospital purchasing very sophisticated equipment to do those procedures. But if we become more isolated, we study a little harder, we study the anatomy a little more, we can do those same techniques that offer the same amount of relief in smaller communities in the office, so that patients that would have to travel miles and miles and miles to get the care they need can have it right there in their own backyard.
In patients that suffer from chronic postnasal drip or runny nose, we use technology to freeze nerves in the back of the nose associated with these symptoms. The device you're looking at is using liquid nitrogen run through a balloon in the back of the nose that freezes the nerves that cause chronic runny nose and postnasal drip. Treatment with these two devices in two different areas over the course of about 5 minutes will lead to a significant reduction in the patient's symptoms and lead to long-lasting results.
I'm going your nose here, my friend. There's one right there. There's one right there. But overall improved. You don't have to put the medications in the salt water anymore, but really rinse the sinuses out. If you're a patient that suffers with runny nose, there are a couple options that we have for you in the office. The first uses very cold technology to freeze the nerve causing the problem. That's called Clarifix. The other is a heat treatment technology that calms the nerve down by treating it with a very hot temperature probe. Now, one is called runny, this is the hot option, and then Clarifix, which is the colder option. The nice thing about Clarifix is that it only treats the runny nose, whereas Rynair helps with both runny nose and nasal congestion, because we're able to use the same device to shrink any swellings that are causing breathing problems as well. So if you're having a runny nose and maybe a stuffy nose, come see us about your options. I'm going your nose here, my friend. There's one right there. There's one right there. But overall improved. You don't have to put the medications in the salt water anymore, but really rinse the sinuses out. Hey, it's Dr. Mashton here at the ENT Center, and one of the primary things that I see come into the office is people with complaints of pressure in their ears, one-sided or both sides. Most of the time, it's something called the Eustachian tube dysfunction, and it's often caused by allergies or even sinus issues. One of the easiest ways to test for that is something called, big word, autoinsufflation. What does that mean? You already know it. You plug your nose and blow, and what you're trying to do is force pressure through your eustachian tubes into your ears. If they pop, then your eustachian tubes are working appropriately. But if you try to blow your nose and you can't pop your ears, that is a sign you probably have a eustachian tube dysfunction. So come see us at the ENT Center. We can help you get through it. Hey, so there's been a lot of questions about office procedures that are available for sinus patients. And great news is in the last 10 years, we've had significant developments in the field. Specifically, when sinus surgery first began, we were using instruments like this to look in the nose from a distance under a microscopic evaluation. That's what this is, a microscope. You put both eyes right here and you can see something magnified in front of that device. We would use very cold instruments to remove polyps and infection from the sinuses. Very gross, very large movements. Now we're doing very targeted devices, such as a balloon device, which allows us to go into the natural sinus openings allows you to dilate them to sizes larger than they were originally, which allows the infection to come out. So instead of using large techniques that are very abrasive, we now use very focused and targeted techniques to allow faster recovery, less downtime, and getting you back to what you were made to do.
Hey guys, we've been seeing a lot of patients come in with sinus infections. The 4 signs of a sinus infection are facial pain and pressure, nasal congestion, drainage, and decreased sense of smell. We see a lot of patients daily that try to treat these at home. By the time they get to us, their quality of life is significantly diminished, and they miss out on big life events. So I'm here to tell you to make an appointment with us today. So when you get here on the day of your procedure, this is our procedure room. We will bring you back here to one of our nurses, and we will walk you through any last minute questions that you may have and answer that for you, get you comfortable. We will dim the lights and let you pick out your music of choice, and so we'll get you all comfortable. And then the actual procedure will take about 10 to 15 minutes. We will walk you through it step by step so you know what's going on as we're doing it. We do require that you have a driver with you that day, so when you're done with your procedure, we'll move you next door and we let them come back and sit with you. We get you a beverage, get you as comfortable as we can. We just want to do everything that we can to make this experience enjoyable and not scary, and just get you feeling better and on your way to that breath of fresh air.
Am I the Joker? Am I the king? Is there a difference when you're next to the queen? So strange to be slipping away. She knew me by name when I found her. So far to be falling from grace. Can't get into heaven without her.
So today, we are dilating the Eustachian tube, which is the connection between the ear and the throat. So it allows us to feel like our ears are at the right level of pressure. And sometimes our ears can feel like there's too much pressure in them. So we use a catheter device that I have in my right hand to dilate the tube. I'm inserting the catheter all the way into the Eustachian tube opening, and then I'm going to dilate it, and we're going to hold pressure there for 2 minutes. All right, we're going to deflate here in 5, 4,
3, 2, 1. And now that left side is dilated. And coming out. And then we're going to do the same thing on the other side. Just moving the catheter through the nose. And then again, we use our common cavity in the back of the nose to see what's happening on the other side. There's the other side of the eustachian tube. And there's the tip of the probe going into the tube. There are markings on the tube that let us know how far to go in. Inflate, Tabitha.
Up.
And as you can see, very little discomfort. We numb it up very well, so the patient can be awake. Most patients actually fall asleep during the procedure. It only takes a total of about 5 minutes to complete. So as you can see, we're about done here on this right side. Very minimal bleeding, almost none at all. The patient is almost asleep because there's very little discomfort. And we're getting ready to deflate the catheter with a balloon device. It should take about anywhere between 2 and 6 weeks to notice full improvement from ear congestion issues or eustachian tube dysfunction. Go ahead and deflate, Tom.
Down.
I'm just going to pull it out. And that you can see a nice open dilated eustachian tube there. Not closed off anymore. Very good looking. You will see all the way up into the tube. And this tube side we've already done. As you can see, no bleeding. Very minimal trauma. And we're all done. Took more than 5 minutes.